Good evening, everyone. My name is Maria Limoronta Sanchez, and I'm the Director of Community Partnerships for the Rutgers Institute for Health, Healthcare Policy, and Aging Research. We would like to welcome you today to this important presentation on long COVID in the brain, produced in partnership with Community Health Promotions and New Brunswick Tomorrow. Our presenters today are Dr. Hundal, who is a board-certified clinical neuropsychologist, an associate professor of neurosurgery, and a director of neuropsychology, and Dr. Chen, who's a core member of the Institute for Health, Healthcare Policy, and Aging Research, and a professor in the Department of Neurology. So before we get started, I'd just like to encourage folks to put questions in the comments, as we will be monitoring the comments throughout the presentation. And thank you so much for joining again, and take it away, Dr. Chen and Dr. Hundal.
Marilee, thank you for that introduction. So I'm here with Dr. Chen, and we're going to talk a little bit about COVID today and some of the complications that people could experience from having had the infection. Briefly, Dr. Chen and I are funded through a variety of sources for our research, but there are no inherent conflicts of interest as it relates to this presentation. Today's agenda is pretty straightforward, and we're going to focus on what is long COVID, how does long COVID impact the brain, and what are some of the acute symptoms as well as the long COVID symptoms, and what can I do if I have long COVID symptoms. So before delving into long COVID, it's always good to review what acute COVID looks like. So SARS-CoV-2, or severe acute respiratory syndrome coronavirus 2, or COVID-19, is a highly contagious respiratory disease caused by the SARS-CoV-2 virus. Symptoms can range from mild, which is maybe a slight ache or some coughing, to moderate, which will require a visit to the doctor's office and a clinical confirmation through maybe a chest CT that you do have some infections in the lung, to more severe symptoms. This is what, and severe and critical symptoms is what will end you up in the hospital. So approximately 81% of people will experience more of the milder course, a mild or moderate course. This typically does not require a hospital level of care. But then 10 to 15% of cases will progress to the severe disease, and 5% of cases can become critical and actually die from the disease. Most people recover from COVID-19 within about a month or 4 weeks. However, those folks that persist in having symptoms, we call them long COVID patients. And long COVID can be divided into two subcategories. There's ongoing symptomatic COVID-19, and for these folks, it's 4 weeks to 12 weeks. And post-COVID syndrome, now these are individuals that have symptoms well beyond 12 weeks. And these are the ones that you hear about in the news, the long haulers or the long haul syndrome or the long haul COVID-19 cohort. And they experience changes in physical, cognitive, and mental health functions. And as I said earlier, about 80% will recover, or 87% will have the milder course, and they tend to recover. But these patients are going to be a subset that persist. And approximately 10 to 30% of the people that have a COVID infection can develop this long COVID syndrome. And in some research, it even goes as high as 62%. So Dr. Chen is going to discuss this in a little more detail, but I want to just talk about what are the symptoms of long COVID. And we'll focus more on the neurological and the psychological factors in the latter part of this presentation. But it's not just related to how you feel or how you're thinking. There are changes in hearing, or you may have some ear aches or ringing in the ear, dizziness, respiratory changes, short of breath, coughing, fatigue, rashes on your skin, tightness in the chest with some cardiovascular complications, as well as gastrointestinal changes such as nausea or diarrhea or abdominal pain. So as you can see from this slide, that COVID-19 can impact a lot more than just your lung functions. On this slide, you're going to see a comparison of some of the acute phase symptoms compared to the long COVID or the long haul cohort symptoms. And fatigue tends to be one of the big ones. And it goes shortness of breath, joint pain, so aches, pains, irritation, dizziness, GI symptoms, so some of the things that I talked about previously. And these are the general range of symptoms, so not just the neurological complications, but all the type of complications that can occur secondary to long COVID. And why do we have such a range of symptoms? Well, that honestly, we're not sure yet. We think that there's a lot of underlying factors that can contribute to people developing the long COVID form. And some of those factors could be your health, such as comorbidities, and I'll talk a little bit about that later, your lifestyle, and genetics. So there may be just some people that have certain risk factors inherent to who they are. So who is at risk? Well, first of all, who's at risk for COVID? I'm sure through all the news coverage and information that's out on different types of media sources, we know that everybody is at risk for COVID. It's an airborne pathogen, and through proper masking and social distancing, maybe we can reduce this. But as of now, everybody seems to be pretty much at risk for contracting the disease. That doesn't mean you're going to have the severe course of it, but you can still get it. But who are the people that are more susceptible or at risk for developing long COVID? Now here we think it's definitely a factor of age. So the older you are, the more you are at risk for contracting COVID, but also having those long COVID symptoms. Being overweight, obesity seems to be a pretty strong risk factor, as well as certain comorbidities like diabetes or lung disease or even kidney disease. And then I'm sure you've heard that there are patients that are going through chemotherapy or have some sort of an immunosuppression medication that they're at increased risk, as well as organ transplant recipients. And then also folks that have more symptoms early in the course tend to be at a higher risk for developing long COVID. With that, I'm going to turn this talk over to Dr. Chen, who's going to talk more about the neuropsychological complications of long COVID.
Thank you, Dr. Hundal. So first, I will talk about acute neurological complications of COVID-19, meaning these are the symptoms associated with the brain at the acute phases when someone still are experiencing the infection of COVID-19. And then I will talk about the long COVID symptoms, which are symptoms related to the brain that is persisting after they've already recovered from the infection. So the most common neurological complications in the acute phases are losing your sense of smell or taste. So 59% of people report that they lost their sense of smell, 51% of people lost their sense of taste, 31% of people report having fatigue. So that's the sort of exhaustion that they feel that they felt, that they've never felt so tired before. So a lot of people report that. 20% of people report having headaches, 7% have dizziness, and then 5% of people have confusion or altered mental status, which usually is, the confusion is usually temporary in this acute phase. And then there are also the more rare neurological complications that some of you might have seen in the news already. So the first one is having strokes. So strokes are essentially having a blockage of blood vessels in the brain that stop oxygen from going into the brain cells, causing the brain cells to die. So that can cause symptoms such as numbness or weakness in the face, the arm, the leg, or sometimes people might have difficulty with speaking. Another rare neurological complication is seizures. So seizures are a burst of uncontrolled electrical activity in the brain. And some people might associate seizures with people having convulsions and shaking uncontrollably. So that's a type of bigger sort of generalized seizure, but seizures can also present in a smaller way. So some people might stare into space. They might have abnormal motor movements. They can lose their awareness. So they might be having these abnormal movements. And when you call them, they won't respond to you. There are also reports of brain infections associated with COVID-19. So that can either be infection of the brain tissues themselves, which is called encephalitis, or infection of the outer lining of the brain, which is called meningitis. There are also peripheral nerve disorders that have been observed with COVID-19. So one of the ones that's getting a lot of attention is called Guillain-Barré syndrome, which involves muscle weakness that typically starts in the legs and can slowly spread to the arms and the upper body. And it does oftentimes present after viral infections, after other viruses. So maybe it's not as surprising that it can also come after COVID-19 infection as well. In terms of risk factors for neurological complications, some of the risk factors that Dr. Hundal talked about earlier about long COVID, such as being older or having more underlying health conditions, are definitely risk factors for having neurological manifestations too. Having a more severe COVID-19 disease course can also predispose someone to having neurological complications. So by having a more severe disease course, I just mean maybe they would require hospitalization or admission into intensive care unit. And then finally, having pre-existing brain disorders might predispose someone to have more of these neurological complications as well. We can go on to the next slide. So these are long COVID neurological and psychological symptoms, which again, Dr. Hundal talked about a little before, but now we're gonna just focus on the neurological and the psychological symptoms. So fatigue, as you saw before, is the most common. 85% of people report having fatigue as a long COVID symptom. 81% of people report brain fog. So this is a term where people use when they're referring to having difficulties with their thinking. So it can be things like just being slower in your thinking than before, having attention problems, being more forgetful, or having difficulties with problem solving, reasoning, and planning. 68% of people still have headache and dizziness. 60% have numbness or tingling. 59% still haven't gotten back their sense of smell or taste. 47% of people report having depression or anxiety symptoms, and 33% of people having sleep problems, which can also affect other symptoms as well. So poor sleep can also affect fatigue, the brain fog that people experience, and also the mood symptoms that people experience. You can go on to the next slide. So in terms of long-term prognosis, so we don't know too much about what happens in the long term. So because we haven't had COVID-19 for that long. And for studies that have investigated long-term outcomes, the longest follow-up period is usually 6 months. So here I'm going to summarize the findings of one study that I felt really gave really compelling results about what happens when you have long COVID and its impact on your life. So in this study, they had 395 people who had COVID and neurological complications associated with COVID. And then they compare that to another group who had COVID but didn't have any neurological complications. And then they compare both groups at 6 months after the infection. And they found that for people with neurological complications, they almost all of them, 91% had at least one abnormal outcome in the different things that they measured after 6 months. And it was significantly worse than people who did not have neurological complications. So for example, 46% of people reported depression, 25% of people had anxiety, and 36% of people had fatigue, 38% have sleep problems, and 50% of people had impaired cognition. And this is when they gave a brief screening measure that measures their cognition. And then 50% were below the cutoff for that test. And then there's 56% of people who reported difficulties with their daily activities. And then almost half, 47% of people reported that they were unable to return to work because of their COVID-19 symptoms, their long COVID symptoms. So this study I thought was really compelling because it really shows that there's a lot of very significant everyday impairment from these long COVID symptoms, to the point where almost half the people felt like they weren't able to return to work. There was another study that also looked at outcomes 6 months later, and they compared people who had COVID-19 to people who had the flu and also the common cold, other sort of respiratory infections. And they found that people with COVID-19 were more likely to have these neurological and psychological diagnoses 6 months later comparing to these other infections. So there is definitely something that's more specific about COVID-19 affecting the brain than other similar type of infection. And go on to the next slide. So how does COVID-19 affect the brain? So here I'm just going to briefly touch upon some potential pathways that COVID-19 can affect the brain. So first is direct infection of brain tissues by the SARS-CoV-2 virus. So there is some evidence of brain infections from clinical cases. There's also finding the virus's genetic materials in the cerebral spinal fluid, which is the fluid inside the skull surrounding the brain and also the spinal cord. They've also found the virus in the brain from autopsies after people have died from COVID-19. So there's some direct evidence of that, but a lot of these studies are small and then they haven't really been very conclusive. And it's also unclear whether that's actually causing these neurological symptoms that we're seeing. Because when they do find the virus in autopsies in the brain, it's always in very small amounts compared to other parts of the brain, such as the lungs. So it's unclear whether that's what's causing the symptoms to begin with. There's also a concern of people with COVID-19 being in a hypercoagulate state. And that just means that people are more likely to form clots in their blood. And that's why we think is causing the strokes that are happening, that because you're more likely to form blood clots and that can travel to the brain and block a blood vessel, and that's why people have strokes. So not having enough oxygen going to your brain is bad for brain functioning. It can present with a variety of neurological symptoms that we've talked about already. But even if someone doesn't have a stroke, they might still have more limited oxygen going to their brain. So if they had respiratory distress because of COVID-19, especially people who needed support for oxygen and being on ventilators, for those people, they also experience periods where there's not enough oxygen going to the brain. So even for those who don't have strokes, they having this less oxygen going to the brain than needed is so bad for brain functioning. And then finally, scientists are also talking about perhaps it is the immune response to the infection that is causing these effects on the brain rather than the virus directly affect the brain. So one of the things that have been that there's a lot of research going on is a severe immune response called cytokine storm, which is when the infection triggers the immune system to overproduce inflammatory proteins called cytokines. So when you have a lot of cytokines that are being overproduced at the same time, it can lead to multiple organ failure. So that can certainly damage the brain as well. So we know that cytokine storms are associated with more severe COVID-19 disease outcomes and also higher risk for mortality. So, but it's a little bit unclear exactly how that might affect the brain and these neurological symptoms specifically. Go on to the next slide. So the bottom line here is regarding the research is that there's still a lot we don't know. Research is ongoing. We don't really know how long do long COVID symptoms last, and that can also vary from person to person. We also don't know which symptoms are directly related to the COVID-19 disease itself, and which might be the result of having recovered from a severe critical illness, especially for people who were hospitalized or were in intensive care units. And then finally, we don't really know exactly how the SARS-CoV-2 virus affect the brain. So earlier I talked about some potential pathways based on what we know so far, but it's still unclear, and the scientists are still trying to figure that out, figure that question out. Go on to the next slide. All right, so that's it for neurological symptoms associated with COVID-19. So now I'm going to turn it back to Dr. Hundal, who will talk a little bit more about what do you do now if you have long COVID symptoms.
Thank you, Dr. Chen. All right, so earlier during my portion of the talk, I had mentioned that not everybody is going to progress into the long COVID stage. Most folks are going to have the virus and recover. So you see here, I have a schematic of what a typical, I would say, workflow is for management. Most folks in the acute phase who recover go about their lives and, they don't need any additional services. However, a smaller subset of individuals are going to have long COVID symptoms. So this is individuals with COVID-related symptoms beyond 1 month, and even those that are beyond 12 weeks. So here we want to really focus on some of the recovery and management aspects of it. And what we've been developing more and more when it comes to COVID care is a multidisciplinary team approach that offers opportunities for long-term monitoring, for mental health support, for rehabilitation services, and also for social support services. Within the rehabilitation services, there are opportunities for working with cognitive changes, so cognitive rehabilitation in addition to physical rehabilitation to improve fatigue, which is a very common symptom, but also some of the other symptoms of pain and aches and GI problems. So when we think of management, we really want to treat and support the physical, cognitive, mental, and social well-being of the individual. And fortunately for us, we're in a location that has a number of excellent programs that can provide this multidisciplinary team approach for care. On this slide, I've listed a few, and through a simple Google search, you should be able to find contact information for each. But if you live around the New Brunswick area, there are 2 specific centers that have a COVID recovery program. One is here at Robert Wood Johnson University Hospital, and the other one is down the street at St. Peter's University Hospital. If you're further north, St. Barnabas Medical Center in Livingston has an excellent program, as well as Kessler, and they all provide this multidisciplinary team approach. A little bit south and west of us is JFK in Edison, New Jersey, at their center, their rehab institute, and then further south we have Bancroft Neuro Rehab, and they're located in Plainsboro. But all these organizations have satellite sites that might be able to provide additional services, and I would encourage you to, like I said, do a quick Google search to find more information. Now, for those that are maybe suffering more specifically from mental health related issues associated with COVID, University Behavioral Health has an excellent COVID Connect program that was set up specifically to manage the psychological consequences of having had the disorder. I have 3 separate graphics here, but they're all pointing towards the same phone number, which is 833-223-0011. And UBHC is able to provide services in English and Spanish and potentially a few other languages. And it's a place that's worth giving a call if you are experiencing more of the depression, anxiety related side of long COVID, or even the acute COVID stage. So with that, we'll open it up to questions.
This was so interesting and informative. Thank you. I just have a couple of follow-up questions before we wrap up. So how does long COVID in any way improve your antibodies and protect you against COVID?
So just because you have long COVID symptoms, it does not mean you have a more robust immune response. So that is a bit of misinformation. Having the disease or having the virus is not going to give you a higher or larger immune response.
Thank you. And will any of these symptoms ever go away?
Dr. Chen, do you want to take this one?
Yeah. So the answer is really that we don't really know how long COVID symptoms last, and it might vary from person to person. So for that, we don't really know how long they will last, but there's definitely a lot of management strategies that Dr. Hundal talked about, that if you have these symptoms, there are ways that we can try to treat and manage some of these symptoms that people want to consider that can help them feel better. But in terms of what happens in the future, unfortunately, we just don't, the science just isn't there yet, and we just don't know.
Yeah, just to sort of reiterate what Dr. Chen said, Unfortunately, we just don't know enough about this disease yet. We're learning more every day, and there's a reason we're putting together these multidisciplinary team care programs, because through those types of interventions, we want to at least be able to mitigate some of the negative consequences of having had the illness. And through more research, through community partnerships, through participation in clinical trials, hopefully we'll have an answer sooner rather than later on, can we remediate or completely eliminate these long COVID symptoms?
Thank you. One last question, if you could just tell us a little bit more what people can do if they are experiencing long COVID, what they can do to improve their symptoms.
So I'll encourage you to first reach out to those COVID recovery programs. There'll be a team of doctors that you can see, and they can really give you a better understanding of what your symptoms are and whether these are, potentially related to COVID or they're related to something else. So first is to get a better understanding of what's going on. And with any neurological disease, part of what we counsel is lifestyle changes, more physical activity. We know exercise is wonderful for brain health. Being more active cognitively is also wonderful for brain health. Finding ways to socialize is also something that can benefit your overall brain health. So there are multiple different strategies that you can implement. And the biggest one I'll suggest is just being more active, eating healthier, being more mindful of your nutritional intake, and then also connecting with these programs to make sure that you are properly diagnosed and then proper treatment can follow.
Thank you so very much to the both of you for this important information. We want to also thank our community partners, New Brunswick Tomorrow and Community Health Promotions, and all of you for tuning in. This video would be available here on Facebook and on our YouTube channel, right at Rutgers IFH. And if you're looking for this information in Spanish, we'll be right back here tomorrow at 6 p.m. In Spanish. And of course, if you aren't already following us, hit that like button, go to Twitter, go to Instagram, and follow us at Rutgers IFH. Thank you so much and have a great night.
Thank you, everyone.